Introduction to Flexibility. The information from this presentation is drawn from two textbooks. The first is Chapter 11 of NSCA's Guide to Test and Assessment, and the second is Chapter 10 of Advanced Fitness Assessment and Exercise Prescription, 7th edition. The text, NSCA's Guide to Tests and Assessments, is an excellent resource for the majority of physical tests covered in this module and in all modules of this course. This presentation's purpose is to outline and discuss the fundamentals of flexibility and mobility. We will discuss the definitions and nature of flexibility, as well as the general benefits of having good flexibility and range of motion. To begin, consider what mobility is. Mobility is the ability to move easily in a fundamental requirement of human movement. A certain amount of mobility is required to complete any task. It could be a daily activity or a sport. The composite motion available at all of the joints involved in the movement, known as kinematic chain, determines mobility. Too much mobility, known as hypermobility, or too little mobility, known as hypomobility, can have a negative impact on performance and increase the risk of injury. As a result, any assessment should include a comprehensive evaluation of joint motion. This video discusses some of the fundamental concepts of mobility, as well as the effects of hyper and hypomobility on performance and injury risk. In the second video, we will go through the techniques for measuring it and interpreting the results. Before we begin, let us distinguish between mobility and flexibility and address the current static stretching controversy and misconception. The amount of motion available at a joint or series of joints, as well as the ease with which the joints can move through their range of motion, is referred to as mobility. Flexibility refers to the extensibility of the periarticular structures, that is, the muscle, tendon, and the fascia. It is one of several factors that can limit the range of motion and impede mobility. According to a growing body of research, static stretching may not improve performance or reduce injury risk. Several studies have also revealed that static stretching can reduce peak force, rate of force development, and power outputs for up to an hour after stretching. When discussing improving flexibility or mobility, two critical components must be addressed. To begin, the acute effects of stretching must be distinguished from the chronic effects of stretching. According to Stone et al. In 2006, the acute effects of static stretching appear to have no benefit in terms of injury reduction and may have a negative effect on performance. This is not to say that static stretching cannot be beneficial over time. Second, most conclusions about the long-term effects of stretching on injury performance may be based on a flawed premise, i.e., more is better. For example, if a cake recipe calls for 2 cups of sugar, adding only 1 cup will almost certainly degrade the cake's quality. However, adding 4 cups would not result in a better cake. For optimal performance, each activity necessitates a certain amount of mobility. The individual performing the activity lacks adequate mobility. Reduced performance and an increased risk of injury are almost certain outcomes. To ensure adequate performance for a task or sport, S&C coaches must understand mobility, determine the mobility demands of a sport, and assess the athlete's mobility as a result. The ability of a joint or series of joints to move through a full range of motion without injury is referred to as flexibility. The musculotendinous unit's extensibility limits static flexibility, which is a measure of the total range of motion at a joint. The rate of torque or resistance developed during stretching across the range of motion is referred to as dynamic flexibility. Despite the fact that dynamic flexibility accounts for 44 to 66% of the variance, More research is needed to firmly establish the relationship between static and dynamic flexibility and to determine whether these two types of flexibility are distinct entities or two aspects of the same flexibility component. The joint's range of motion is highly specific. It is determined by morphological factors such as joint geometry, the joint capsule, as well as ligaments, tendons, and muscles that span the joint. The planes of motion are determined by the joint structure, which may limit the range of movement at a given joint. Our body has 5 major types of joints, each with its own set of characteristics and functions that allow us to perform a variety of movements. Gliding joints, like those found in our wrists and ankles, allow for sliding, gliding, and twisting movements in multiple directions. Following that are hinge joints, which function similarly to door hinges by allowing movement along a single axis, such as flexion and extension. Elbow and knee joints are 2 examples of a hinge joint. Moving on, pivot joints revolve around a single axis. The proximal radial ulnar and atlantoaxial joints are 2 examples of pivot joints. The forearm contains the proximal radial ulnar joint. The radial and ulnar bones, which are the 2 long bones in your forearm, are involved. The joint allows these bones to rotate around each other, allowing you to twist your forearms like you would turn a doorknob or screw in a light bulb. In contrast, the atlantoaxial joint is located in your neck. The atlas, first cervical vertebra, or C1, and the axis, which is the second cervical vertebra, or C2, form a pivot joint. This joint allows your head to rotate from side to side, similar to how you would shake your head to indicate no. Fourth, we have condyloid and saddle joints, which allow for 2-axis movements such as flexion, extension, abduction, and adduction. These joints can be found in our fingers and thumbs. Finally, there are ball and socket joints, which have the greatest range of motion. These joints, such as the shoulder and hip, allow for multiple axis movements such as flexion, extension, abduction, adduction, and rotation. This is also known as having triaxial axis of rotation. The tightness of soft tissue structures like muscles, tendons, and ligaments limits both static and dynamic flexibility. The relative contribution of soft tissue to the total resistance encountered by the joint during movement was determined by Johns and Wright in 1962, highlighting that the joint capsule contributed 47%, muscle and fascia 41%, tendons or ligaments 10%, and skin 2%. The joint capsule and ligaments are primarily composed of collagen, a non-elastic connective tissue. However, because the muscle and its fascia have elastic connective tissue, they are the most important structures for reducing resistance to movement and increasing dynamic flexibility. Tension within the muscle tendon unit influences both static flexibility and range of motion, as well as dynamic flexibility, stiffness, or resistance to movement. The viscous elastic properties of connective tissues, as well as the degree of muscular contraction caused by the stretch reflex, are responsible for the tension within this unit. People who are less flexible and have tight muscles and tendons have a greater contractile response. During stretching exercises, there is more resistance to stretching. During stretching, the elastic deformation of the muscle tendon unit is proportional to the load or tension applied, whereas the viscous deformation is proportional to the speed at which the tension is applied. When a muscle or tendon is stretched and held at a constant length, tension within the unit or tensile stress decreases over time, as seen in static stretching. This is known as stress relaxation. A single static stretch lasting 90 seconds increases viscoelastic stress relaxation by 30% and reduces muscle stiffness for up to an hour. Extensive research on the viscoelastic effects of stretching has clearly shown that increases in joint range of motion are associated with decreases in passive resistance to stretch. The immediate and long-term effects of static stretching, on the other hand, are dependent on the total duration of stretching. A 2-minute stretch has no long-term effect on muscle stiffness. 50% of the effect of a 4-minute stretch on passive resistance is lost after 10 minutes, and 50% of the effect of an 8-minute stretch is lost after 30 minutes. According to Nakamura and colleagues in 2011, 5 minutes of static stretching reduced muscle tendon unit and muscle stiffness, and this effect lasted for at least 10 minutes after static stretches. According to Herder and colleagues in 2011, the types of static stretch has an effect on muscle tendon stiffness. Constant tension static stretching is more effective than constant angle static stretching in reducing muscle tendon stiffness. However, both types of static stretching result in similar increases in range of motion and decreases in strength. To date, little attention has been paid to the acute effects of dynamic stretching on passive muscle stiffness. Samukawa and colleagues in 2011 found that dynamic stretching of the plantar flexors for 5 sets of 30 seconds increased the range of motion of the ankle dorsiflexors significantly. Talking about dynamic stretching, although markers of muscle tissue change such as pronation angle and fascicle length remain unchanged, dynamic stretching increased the displacement of the musculotendinous junction. Furthermore, it was found that 6 weeks of static and ballistic stretching had different effects on passive resistance torque and tendon stiffness. Both types of stretching improved ankle dorsiflexion range of motion. Static stretching significantly reduced calf muscle passive resistive torque, but it had no effect on Achilles tendon stiffness, whereas ballistic stretching had the opposite effect. The Achilles tendon stiffness decreased, but the plantar flexors passive resistance torque remained unchanged. Body type, age, gender, and level of physical activity all influence flexibility. This section answers some of the most frequently asked questions about flexibility. Individuals with large hypertrophied muscles or an excessive amount of subcutaneous fat may perform poorly on range of motion tests because their adjacent body segments contact each other sooner than those with smaller limbs and trunk girths. This does not, however, imply that all people who are heavily muscled or who have large amounts of subcutaneous fat have poor flexibility. Many bodybuilders and obese people who stretch their muscles on a regular basis have adequate levels of flexibility. Inflexible and older people have more muscle stiffness and a lower stretch tolerance than younger people with normal flexibility. With age, static flexibility decreases as muscle stiffness increases. The primary causes of aging flexibility loss are a decline in physical activity and the development of arthritic conditions rather than a specific effect of aging. Nonetheless, flexibility training can help to compensate for age-related decreases in range of motion. For example, it was reported that 10 weeks of flexibility training resulted in significant improvements in shoulder and hip range of motion in older men between the ages of 50 and 69. Thus, older people can benefit from flexibility training and should be encouraged to do so at least twice a week to compensate for age-related decreases in range of motion. Some evidence suggests that females generally are more flexible than males at all ages. Women's greater flexibility is typically attributed to gender differences in pelvic structure and hormones that may influence connective tissue laxity. Morse in 2011 compared the stiffness of men's and women's gastrocnemius muscles. Although there was no gender differences in passive torque throughout the range of motion, females had a 26% greater distal displacement of the myotendinous junction, and men had a 44% greater gastrocnemius stiffness. Gender appears to have a joint and motion-specific effect on range of motion. Females have greater hip flexion and lateral spinal flexion than males of the same age. Males, on the other hand, have greater range of movement, hip extension, and thoracolumbar spinal flexion and extension. Gender, age, and body type appear to be less important determinants of flexibility than habitual movement patterns and physical activity levels. Inflexibility is exacerbated by a lack of physical activity. Inactive people are less flexible than active people, and exercise increases flexibility. Disuse caused by a lack of activity or immobilization causes muscle shortening, that's contracture, and connective tissue shortening, limiting joint mobility. Moving the joints and muscles in a repetitive pattern or maintaining habitual body postures may limit range of motion due to muscle tightening and shortening. Joggers and people who sit at a desk for long periods of time, for example, must stretch their hamstrings and lower back muscles to counteract the tightness that develops in these muscle groups. Although active warm-up exercises like walking, jogging, and stair climbing raise muscle temperature and decrease stiffness, they do not increase range of motion. The impact of combining stretching and active warm-up on passive resistance to stretch has received little attention. Active warm-up combined with static or dynamic stretching, on the other hand, has been shown in some studies to be more effective than stretching alone in increasing hamstring muscle length and improving range of motion. In fact, it was found that 5 minutes of running before and after static stretching increased hip flexor range of motion more than static stretching alone, or 10 minutes of running before static stretching. The range of motion improvement lasted for 30 minutes. It's important to understand that excessive stretching and flexibility training could lead to hypermobility or an increase in joint range of movement above normal acceptable levels. Hypermobility may lead to joint laxity, that's looseness or instability, and increases the likelihood of musculoskeletal injuries. Gymnasts and swimmers, for example, are prone to shoulder dislocations due to joint laxity and hypermobility. As an S&C coach, you need to be able to accurately assess range of motion and design stretching programs that increases your athlete's flexibility while maintaining joint stability. That concludes this first video in flexibility and mobility. Join us in the next video as we discuss mobility testing and assessments.